There's this very specific, almost universal 3 a.m. anxiety that I think a lot of you listening right now are going to recognize immediately.
Oh yeah, it's the tectonic plates shifting in your family dynamic.
Exactly. It's that sudden, cold realization that your parents, the people who raised you, right, the ones who are always the strong ones,
Yeah,
that they are starting to struggle to live independently.
it is genuinely scary because it's completely uncharted territory for most adult children.
It really is. I mean, you start seeing the house is maybe a little messier than usual,
Mm.
or you notice a bruise they can't quite explain because they bumped into a coffee table.
Yeah, and that's when that tension starts.
Hmm.
You want them to be independent, to stay in the home where all their memories
Like,
are.
you also have this terrified realization that they might not actually be safe there anymore.
And that right there is usually the exact moment the guilt trap snaps shut.
The guilt trap, yeah.
Because you feel guilty if you intervene.
Great.
You feel like you're taking away their autonomy. But then you feel incredibly guilty if you don't intervene because you're risking their safety.
So that tension, that exact wedge, is what we are trying to remove today.
Welcome to our deep dive. Today we are looking into the infrastructure of aging in place with dignity. And specifically, we're diving deep into the services and the core philosophy of what we do here at Focus Family Care.
Because it's not just about hiring help, it's about building partnerships in care.
Exactly. We are a private in-home care agency serving South Florida, and today we're unpacking our own service overviews and client feedback to show you how this problem gets solved without ever compromising a loved one's dignity.
And honestly, I'm glad we are pulling back the curtain on our own materials today. Because when you look at the documentation, the service menu, the reviews focus family care really bridges that gap between skilled medical support and just, compassionate daily living assistance. We don't just staff a house. We build a medical and social support system right inside the home. But before we even start unpacking the whole model, from Alzheimer's care to insurance logistics, I want to be completely upfront with you.
Yeah, this is important.
If you are listening to this right now and you are currently in that crisis mode we just described, if you're in South Florida and you are scared about a loved one's safety today, you don't have to wait. The solution is literally reachable right now. You can call us at Focus Family Care at 561-693-1311.
Or you can visit focusfamilycare.com.
Right. 561-693-1311. Just keep that number handy because as we go through this deep dive, you're going to see that speed of access is a massive part of what we do.
When you're in a crisis, you really don't want to fill out a web form and wait 3 business days.
Yeah.
You want a human being.
You need a human. So let's start at the very beginning. Private in-home care. I feel like this term gets thrown around so much, but if I asked 10 people to define it, I'd get...
You get 10 totally different answers.
Exactly. Some people think it's just a maid service, while others think it's like building a full-blown hospital ICU in your bedroom.
Yeah.
So looking at our own Focus Family Care materials, how do we actually define what we're talking about here?
Well, it's really a spectrum, and I think that's the most critical takeaway from our services documentation. We don't treat care as a binary switch.
Like you're either perfectly fine or you're hospitalized.
Right, exactly. We view it as a gradient, and Focus Family Care covers that entire gradient.
Okay, let's unpack that gradient a bit, because I think a lot of listeners assume you only call an agency when someone is completely bedridden.
And that's the biggest misconception out there.
Yeah.
So on one end of the spectrum, you have what the industry calls non-skilled care.
Which is kind of a terrible name.
I hate the term. It sounds so unimportant. But in reality, non-skilled care is the absolute foundation of human dignity. This is assistance with the activities of daily living.
This is the stuff that actually allows you to just function.
Precisely. We are talking about bathing, grooming, hygiene. Just think about the sheer physical difficulty of getting in and out of a wet shower when you have mobility issues.
It's slippery. It's terrifying.
It's incredibly dangerous. So Focus Family Care sends trained professionals to manage that hygiene, which prevents infections and, honestly, just keeps their morale high.
I noticed meal preparation is a big part of that non-skilled list, too. And again, it sounds simple on paper, like having a personal chef, but when you look at the deep dive notes, it's really about health management, isn't it?
Oh, absolutely. Malnutrition in seniors is this massive silent epidemic. They might just lose the energy or the desire to cook, so they end up snacking on toast or just having tea.
Right.
We aren't just dropping off a warm container of food. Our caregivers are preparing nutritious meals, ensuring the client is actually eating them, and crucially, monitoring their hydration.
Hydration is huge.
It is everything. Dehydration in seniors often mimics dementia. They get confused, they get weak, they fall. Having a caregiver there to simply say, hey, let's drink a glass of water, is a proactive medical intervention.
That's a really great point. It's proactive. And speaking of proactive, our caregivers also handle medication reminders, which completely solves that horrible family panic of, did mom take her blood pressure meds today or did she accidentally take them twice?
Exactly. It provides an external brain to ensure medical compliance. But as we move up that gradient we were talking about, and this is where Focus Family Care truly differentiates itself from just being a sitter service, we are a full medical resource. We offer skilled care.
This is where the registered nurses and LPNs come into the picture.
Yes, private duty nursing. This isn't just companionship. This is high-level clinical care, wound care, catheter care, managing IVs. But the thing that always stands out to me in our service offerings is the therapy services.
Yeah, that surprised me initially too. Do occupational therapy, physical therapy, speech therapy.
All directly in the home.
Right.
Just think about the pure logistics of dragging a recovering stroke victim out to a clinic 3 times a week.
It's exhausting for everyone.
It's demoralizing.
Yeah.
So Focus Family Care brings the rehab facility right to the living room.
And we also handle specific recovery protocols. Our materials explicitly mention post-operative care for things like cataracts and hysterectomies.
Which is vital because hospitals are discharging patients faster and faster these days. You get a major surgery and literally 6 hours later, you're sitting on the curb waiting for a ride.
Yeah, still groggy from anesthesia.
Right. We fill that gap so you aren't trying to navigate a complex recovery alone.
So effectively, choosing Focus Family Care for aging in place means you can have a hospital-level event, but actually recover in your own bed.
That is the ultimate goal. It disrupts that whole pipeline that leads straight to a nursing home. It allows the senior to stay in the environment they actually control.
Okay, I want to pivot to the human side of this for a second, because we can talk about clinical protocols and tasks all day long, but the reality for you listening is that you are inviting a total stranger into your house.
Yeah.
And that is a very intimate, very vulnerable thing to ask of a family.
It's the #1 barrier to entry. People always say, I don't want a stranger sitting in my living room watching TV.
Right. And reading through the actual client testimonials in our stack today, it's clear Focus Family Care is hyper-aware of this friction. We don't just talk about staffing a shift, we talk about matching.
The matchmaking inside. This is fascinating. Usually, a typical agency just looks at a spreadsheet. The client needs someone Tuesday at 2 p.m. Caregiver A is free. Tuesday at 2 p.m. Boom, match.
But we use a completely different heuristic.
We do.
There's this review from a client named Etta Kuttner. She was managing the care for her 92-year-old mother, and she explicitly highlighted that Focus Family Care did a, quote, careful matching of personalities.
That word personalities is doing so much heavy lifting in that review. It means we actually looked at her mother's temperament.
Yeah.
Maybe she's super chatty, or maybe she's quiet and likes strict routines. And we found a caregiver who vibrates on that exact same frequency.
And Etta said it fostered a wonderful and trusting relationship.
Because trust is the currency of care.
Wow, yeah.
If the senior doesn't trust the caregiver, they aren't going to let them help with the bath. They won't eat the meals. The actual clinical outcomes depend entirely on that personal relationship. At Focus Family Care, we understand that the relationship itself is part of the therapy.
I also saw a review from Sherry Levy, who called our staff very hardworking and personable, and another from Celia Miskey, who literally said her aunt is happier and more secure.
Happier? You know, that's a metric we really don't track enough in healthcare. We track blood pressure and heart rate, but we rarely track happiness.
We really don't. But looking at our YS section, it's clear we build this trust on a massive foundation of rigorous vetting. We address that stranger danger fear head on.
Absolutely. We emphasize that every single caregiver is certified, experienced, and professionally trained. They're heavily vetted. You aren't just getting some gig worker who decided to try out caregiving for the weekend.
Right, you are getting a career professional.
You're hiring a partner for your family.
A partner. I love that. So let's go a little deeper into the problem-solution framework that we use. Because so often, families know the symptoms of the problem, like mom seems sad or dad keeps tripping, but they don't know the actual solution. Focus Family Care breaks this down into 3 big buckets.
Let's look at bucket number 1, loneliness.
The silent killer.
It really is. The Surgeon General recently compared chronic loneliness to smoking 15 cigarettes a day in terms of its health impact. So Focus Family Care offers companion home care as a distinct, dedicated service.
But what does that actually look like in practice? Is someone just sitting there staring at them?
No, and that is the key difference. Our materials talk about active engagement. Friendly conversation, playing board games, reading books together. It's targeted cognitive stimulation.
Which is so important.
If you have a parent with early-stage dementia, that regular interaction actually slows the cognitive decline. It keeps those neural pathways firing.
So we are treating the mind and the spirit, not just the physical body.
Correct. Then you have bucket number 2, safety and fall risk.
Yeah.
This goes back to that 3 a.m. anxiety we opened with.
The absolute terror that they trip on a rug and can't get back up.
We address this directly with mobility assistance, but it's highly technical. It's all about transfers.
Can you define transfers for the listeners?
Sure. A transfer is the biomechanical process of moving a human body safely from a bed to a wheelchair, or from a wheelchair to a toilet. If you do it wrong, the patient falls, or the family member trying to help throws out their own back.
Right.
Our focus staff are extensively trained in these safe transfer techniques.
And the materials also mention exercise guidance.
Proactive care again. We help the senior maintain enough core and leg muscle mass to prevent the fall from happening in the first place. We don't just watch them, we help them stay strong.
And what's the third bucket?
Medical compliance and health monitoring. We touched on the pill reminders, but it goes much deeper. Our caregivers effectively become the eyes and ears for the doctor.
How does that work in practice?
Well, think about it. A doctor sees a patient for maybe 15 minutes once a month. A caregiver sees them for 8 hours a day. They notice if the appetite suddenly drops. They notice if their walking gait changes. We emphasize that our caregivers report these changes immediately. We coordinate directly with the healthcare providers.
That removes such a massive burden of detective work from the family. You don't have to call mom and try to guess if she sounds sick over the phone. You have a trained professional on site who actually knows.
It turns reactive panic into proactive management. And honestly, that management is what you're really getting with us.
Now, there's one logistical feature we offer that I think is a total game changer, especially for working families: availability.
Yes, the 24/7 promise,
Our office is literally listed as open 24/7, 7 days a week.
which is incredibly rare in this industry. Usually, agencies switch over to a third-party answering service after 5 p.m. But Focus Family Care has actual staff available, and we offer care on whatever schedule you need, hourly, overnight, or true round-the-clock live-in care.
Why is that continuous 24/7 access so critical?
Because medical crises do not respect normal business hours. Strokes happen at 2 in the morning, falls happen on a Sunday afternoon. If your daughter living in New York and your mom in Boca Raton falls on a Saturday night, you need someone to pick up the phone right then.
Not Monday at 9 a.m.
Exactly. Focus Family Care provides that continuous, unbroken lifeline.
Okay, so we've established the quality, the huge scope of services, and the constant availability. But now we have to talk about the elephant in the room. The one question that stops most families from even picking up the phone to call us.
How on earth do we pay for this?
It's terrifying for people. In-home care has this reputation for being just incredibly expensive.
It does. But this is where Focus Family Care really shocked me when I first looked at our own administrative capabilities. We are on a mission to completely lower that financial barrier. We actually accept over 100 different insurance plans.
Over 100. That is unusually high for an agency.
It's staggering. It means we have a dedicated administrative team just handling credentialing and billing. We specifically work with Sunshine Health, Florida Community Care, APD Health Insurance, and this is a big one, Medicaid Home Healthcare coverage.
Medicaid is huge. A lot of agencies just flat out refuse to take Medicaid because the paperwork is an absolute nightmare.
Right. But we've built our business model around true accessibility. We even assist families in understanding their private payment options if Medicare doesn't happen to cover a specific non-medical need.
So we act as a financial counselor as well as a care provider. That has to be a major stress reliever for families.
We call it insurance made simple. And if you've ever tried to read a health insurance policy,
Simple is a miracle.
it truly is.
So if a listener is thinking, okay, this sounds amazing, but I simply do not have the bandwidth to deal with a mountain of onboarding paperwork right now, what is our actual process? How hard is it to turn the key?
We've streamlined it down to a simple 3-step process. I love this because it deeply respects the family's stress level.
What's step one?
The phone consultation. It's totally low stakes. You just call us, you describe the situation, there's no pressure, you don't have to sign a contract on the spot, you just talk to us.
And step two?
The healthcare assessment. This is crucial. Our clinical team comes directly to the home.
Mm.
We don't make you drag your fragile loved one out to an office somewhere. We walk the physical space. We look for trip hazards, we evaluate their specific medical needs, and we build a fully customized care plan right there in the living room.
And then step 3 is the matchmaking we talked about earlier.
Yes. Once the plan is locked in, we select that perfectly compatible caregiver, the one who matches both the clinical needs and the personality. And then the service just starts.
It sounds incredibly frictionless.
It's completely designed to be. When a family is in crisis, friction is the enemy. Focus Family Care removes all that friction so you can just focus on loving your family member.
I want to zoom out for just a second here and clarify exactly who we serve, because we've spent a lot of time today talking about mom and dad, geriatrics. And looking at our geriatric home care and Alzheimer's care listings, that is clearly a core competency. But is that all we do?
No, and this is a vital nuance. Our name is Focus Family Care. It is not Focus Senior Care.
Right. What else is on that service list?
We also provide pediatric home care and autism home care.
Oh, wow. That is a completely different, highly specialized skill set.
It really is. We offer dedicated support for children with autism, cerebral palsy, and other developmental disabilities. We also provide specialized therapy and support for people recovering from traumatic brain injuries.
So if you are a young family with a child who has complex medical needs, or maybe your spouse was in a car accident and has a TBI, Focus Family Care is also for you.
Exactly. It's comprehensive family support across the board. Whether the patient is 8 years old or 80 years old, if they need skilled support to live safely at home, we have the staff and the expertise. We are a family-centered agency in the truest sense of the word.
That's such a vital distinction to make. Now, we've been saying South Florida generally this whole time, but for our listeners who are ready to pick up the phone right now, we need to be specific. Where exactly is our geographic footprint?
We cover the southeast coast of Florida very thoroughly. If you look at our service map, we are heavily positioned in Palm Beach County.
Okay, so that's West Palm Beach, Boca Raton, Jupiter.
Delray Beach, Boynton Beach, yeah, all those major hubs. But we also extend down south into Broward County.
So Fort Lauderdale, Hollywood.
Yes, along with Pembroke Pines and Miramar. And we go even further south deep into Miami-Dade, so Miami, Hialeah, Homestead.
Wow. And what about north of Palm Beach?
We've got the Treasure Coast covered too. Martin County, Sir Stewart, and Jensen Beach. St. Lucie County, including Port St. Lucie and Fort Pierce. And we even reach up into Indian River County and Okeechobee.
That is a massive service area.
It is. Basically, if you are on the Atlantic side of South Florida, Focus Family Care can reach you.
As we wrap up this deep dive, I just keep coming back to that one phrase from Edda's review: peace of mind.
It's the ultimate return on investment, isn't it?
It really is. Families spend so much energy just worrying. We worry if they're eating, if they're lonely, if they accidentally left the stove on again. And that constant worry just drains all the joy out of the relationship.
That's the real tragedy of caregiving burnout.
Yeah.
You slowly become a case manager instead of a son or a daughter. You spend all your visits refilling plastic pill boxes instead of just holding their hand and talking.
Right. And what we're offering here at Focus Family Care is a way to effectively resign from your exhausting job as case manager and get rehired as a family member.
That is beautifully put. When you know a vetted professional is handling the slippery shower and the complex meds and cooking the meals, you can just go over to the house and have coffee. You can talk about the grandkids. You can actually enjoy the time you have left together.
And you know for a fact they're being treated with absolute dignity.
Dignity is the operative word for everything we do. Whether it's helping a child with autism navigate their daily routine, or helping a senior recover from surgery without losing their independence, it is entirely about preserving the human spirit.
And doing it with a partner who navigates the whole insurance maze for you.
Which definitely helps.
It certainly does. So let's make sure everyone listening has the exact information they need. If you have been listening to this deep dive today and you felt that familiar knot in your stomach because you know someone who needs this level of care.
Don't wait for the fall.
Exactly. Don't wait for the crisis.
Be proactive. The initial consultation and assessment are completely free. There is literally no downside to just having the conversation with us.
You can call us at Focus Family Care right now. That number again is 561-693-1311. I'll say that one more time. 561-693-1301.
Or you can just check us out online.
Yes, go to focusfamilycare.com. You can see the full comprehensive list of our services. You can read those amazing reviews from Edda and Sherry for yourself, and you can request that free consultation.
And remember, we are here 24/7 So even if you are listening to this deep dive late at night and you're just laying there worrying, there's a real person there to answer the phone right now.
You are not alone in this. There is a whole system ready to help you and your family today. I want to leave you with one final thought to mull over. What is the emotional legacy you want to leave with your aging parents? Is it a legacy of constant stress and medical logistics, or is it one of simply being a family again? We can help you get back to being a family. Thanks for diving deep with us today.
It was a great conversation.
Take care of yourselves and take care of your families. We'll see you on the next deep dive.